My name is Eric Procher, and I represent Jesse Brown VA Medical Center. And you're watching Veterans Issues, and we have a special guest today, and her name is Renee Stolarczyk. She is a nurse practitioner, and she is the newest member of Jesse Brown's Transition and Care Management Team. And you're watching a live call-in interactive program brought to you by CAN TV 21. And over the next 25 minutes, we're going to be talking about the role of the nurse practitioner in patient care. We're going to be talking about the interdisciplinary team at the Jesse Brown's Transition Care and Management Clinic. And we're going to be talking about the needs and answering any questions related to care of our most recent veterans from Operation Enduring Freedom, Operation Iraqi Freedom, and Operation New Dawn. So, welcome. Call us now. The phone number is 312-738-1060. Our phone lines are now open. Hi, Renee.
Hello.
Thank you so much for coming in.
Thank you for having me.
And how long have you been at the Transition and Care Management Clinic at Jesse Brown, which I'm also a team member. We are colleagues, and we work across the hall.
Indeed we are.
Yes.
Yes, we are. I have been with the TCM clinic for maybe 6 or 7 months.
Mm-hmm.
I was with the VA. I've been with the VA for about 16 years. With Jesse Brown, perhaps almost 3 years now. And I was lucky enough to snag a really wonderful position in the TCM clinic. And I'm really enjoying it so far. Very nice.
Okay, so why don't we just start off with what your role is in the clinic, the Transition Care and Management Clinic, which I would describe as a post-deployment clinic for our newest veterans that have had military service after 9/11, and we have an interdisciplinary team, excuse my tripping over my words, which includes the backbone of the clinic are probably the social work, and that's the care management part of what we do, and the social workers that provide case management and help with transitioning needs of veterans as they come off of active duty and move into the civilian world. But then there's also a primary care component where we have primary care doctors that work in the clinic, and we have a recreational therapist. We've had her on the show a few months ago. We have a transition care, what was Leila's position?
Don't know.
TPA, transition
Patient advocate?
transition patient advocate. And then I'm a psychologist, and then there's a part-time psychiatrist there, and we have a bunch of trainees, and we have a health tech who's also a veteran there, and then we have your role as a nurse practitioner. So why don't we talk about the different roles, and we'll start off with yours and how you add to the team.
So just to kind of give some groundwork, nurse practitioner is, and I'm an RN, registered nurse, and
so a nurse practitioner, right? An RN, but an RN doesn't prescribe medications.
an RN with a bachelor's degree, correct, does not. RN with an advanced practice degree, a master's degree, or a doctorate degree can.
So you have a doctorate of nursing.
Right.
Oh, so you
Correct.
They call you Dr. Stolarczyk.
They can, yes. I prefer Renee, but yes, absolutely.
Okay. Great.
So I'm kind of embedded with the whole team, social workers, the psychiatrists, and so forth. I'm full-time, and I work alongside everyone else and see the post-9/11 veterans. I work primarily in the mental health area. So
what's the difference between your role and the psychiatrist role and the psychologist role and the social work's role
Good question.
in this clinic?
So we kind of all play different parts, piece of the parts. Everyone has a very important role. Not to say one is more important than the other. I work with the mental health service line, so I'm going to be seeing those veterans who are coming out and maybe need some screening for mental health issues. I will do full psychosocial exams and see if what kind of needs the veteran may have, or for maybe some depression or a post-traumatic stress disorder, or anxiety disorder, panic disorder, substance use disorders. See what their needs are, the wants are, and kind of educate.
So if a veteran comes to Jesse Brown and they served in the military after 9/11, and they have concerns about maybe depression, sleep, anxiety, or anything that relates to their emotional functioning, or even maybe concentration from traumatic brain injuries, where would they go?
They could start at our clinic. They'd get an assessment from our social worker, and then they would get some screening done, and ask them just kind of general questions as to where they're at.
So let me stop. So our clinic is the Transition and Care Management Clinic, and you'll see a flyer on your screen at home, and the number to our clinic is 312-569-5900, and we are Jesse Brown VA Medical Center. So this is all veterans. We serve all veterans in Cook County up to northern Indiana, and we have outpatient clinics in different areas of the city as well. But the main hospital is a good place to start, and we're located at 820 South Damon Avenue, Chicago. Zip code is, or area code is 60612, and we're on the 4th floor of the Damon Pavilion. So when you come into the hospital, there's 3 main pavilions: Ogden, Taylor, and Damon. We're on the Taylor on the 10th floor. Come up to the Transition and Care, TCM for short. And so someone comes in, and then they'll meet maybe a social worker, which would probably be Dan Stalonis. Hi, Dan. And then we have a health tech, and we check in, and it's like, okay, I think this guy or woman, this man or woman has some concerns and wants to be evaluated for. And so you are the front end, you are the face, you are the first line of connection and help for the veteran seeking help.
So that's important because a lot of veterans may be reluctant to come in to seek any kind of care. So I really try to put he or she at ease, just to say that you don't have to come in and lie on a couch and tell me all your childhood secrets. You just come in, let me know how you're doing, how you're readjusting, how are things going, are you have any difficulties with sleep or anxiety or panic attacks, and how are things going since you left the military, and or if you're getting discharged soon, how is that transition going? So I kind of start there, meet the veteran where they're at, and kind of say, we're just going to talk a little bit about what's happening right now, and then no stress, and then at the end of the interview perhaps talk about what the VA has to offer, and what they may or may not want to do, what services we have, and we come up with a plan together. And I always preface that by, you don't have to engage in any type of services if you don't want to. Just we try to offer services and educate and let people know what's available.
And for those of you that have just joined us, you're watching a live call-in show brought to you by CAN TV, and we have Dr. Stolarczyk, or Renee, as she likes to be called, who's a nurse practitioner in our Transition Care Management Clinic at Jesse Brown VA, and it serves the post 9/11 veteran, and they serve a continuum of needs. It's a one-stop shop, and so maybe we should backstep a little bit, because some people might be asking, well, that's a nurse in this role. How would that be different than a psychiatrist, or what's the difference between a doctor in nursing versus psychiatry versus psychology? And we have a little clip that might help explain this, and then we'll follow up with some questions. But if you're watching at home, please give us a call. All right.
Nurse practitioner is an advanced practice clinician who has the education, training, and experience to manage a patient's full spectrum of issues. Often part of an interprofessional team, nurse practitioners understand the diverse complexity of a patient's health, family, social, and spiritual well-being. We can diagnose and treat acute, episodic, and chronic conditions and work in settings that span from outpatient and community practice to inpatient, high acuity, and critical care. My name is Dr. Ray Blush. I'm an acute care nurse practitioner, the program lead for the adult gero acute care nurse practitioner and clinical nurse specialist program here at the University of Michigan. My primary focus had been emergency medicine, both as a staff nurse and then as a nurse practitioner. And I now work at the University of Michigan Health Service with the Adult Internal Medicine Service.
Hi, I'm Emmanuel. I'm a nurse practitioner here at St. John Oakland Hospital. I heard you want to know more about me and what I do here, so come along.
Hi, Ms. Smith. We're going about getting you discharged today. Your labs are looking good. I'm going to ask the nurse practitioner to come in and make sure that everything's okay, and then maybe he can let you go. Okay.
Hey, Anna. Hey, Mrs. Smith. Looks like your labs are looking very improved today, so it looks like we're going to be able to send the patient home.
Okay.
As a nurse practitioner, that's what I am first, as a nurse. And although we provide medical treatment and management alongside our physician and physician assistant counterparts, where I feel that we differ is our philosophical approach in providing holistic care in regards to a patient's social, spiritual, and cultural needs, which help us promote self-care initiatives and wellness. In addition, we work day to day with our nurses, case management, and social work team to ensure a safe discharge and to address any social concerns that may come up. I've taken my...
So maybe that's a good, so in that video, we see that much like MDs, the nurse practitioner can have many different roles in medicine.
Correct.
And so you have a specialty in
Mental health.
Mental health.
Mhm.
Can you tell us about what inspired you to pursue a career in role in mental health? And it sounds like from your experience, you probably have experiences in other areas as well. Why don't you tell us a little bit about that?
So I've been a nurse for almost 30 years. Started off as a nurse in the hospital. Pretty much worked in inpatient mental health. And then I wanted to go back to school to do a little bit more, so I became a nurse practitioner. I went to Case Western Reserve University in Cleveland, and I became an adult nurse practitioner, which is a focus in primary care, which is like a medical nurse practitioner in the office setting, not in the inpatient setting. So I worked a little bit in that area, and I started working at the VA here in Chicago, and I wanted to focus more in mental health with veterans. So I went back to university, went to Rush here in Chicago, and then focused in mental health as well, and graduated maybe almost 10 years ago. And so now my primary focus is mental health. So I deal with chronic, acute mental health illnesses, can diagnose, treat, prescribe medications as well. And I work in collaboration with a physician for the more advanced or more difficult cases. But I pretty much work independently on my own for the most part. So.
Great. So when a veteran comes to see you, what can they expect?
So they can expect first an orientation as to my role, as to what I do versus what a physician does, versus our psychologist. And kind of from there we go into do the complete psychosocial. Then I explain kind of services at the VA. And then I also reiterate what the role of the psychologist would be into more in-depth therapy than perhaps that I would have time to do. And I explain the psychiatrist as well, or how our roles kind of overlap. I always offer, if they prefer to be seen by a psychiatrist versus a nurse practitioner, they always have that option as well. Some people, have experience with nurse practitioners in the past. They really like them. Some prefer the MDs, which is totally individual. So I always offer that to them as well. And then we just kind of take it from there.
So you come in and you go, okay, you discover like, oh, okay, I think you might be suffering from PTSD and major depression, and maybe you're not sleeping too well and drinking a little bit too much. What would happen next?
So I always go engage what's going on with the patient at that moment. Are they willing to go into therapy? Were they interested in medications? I never go down a road that they don't want to go down, because then that doesn't lead anywhere really good. So I kind of educate what's available, kind of see where they're at the moment. If they're open to medications, then I kind of go over that and pull up some information on some of our VA websites, talk about some medications that we perhaps may use for insomnia.
So so they could be expected to be treated that day.
Absolutely.
Great.
Absolutely. And if they wanted to pick up medication that day, that's all, available. If they prefer to have it mailed, we can do that as well. If they don't want medication, that's totally fine too. If they prefer talk therapy, if they're wanting to kind of have a more informal talk therapy, they can schedule with me, because I'm more readily available. I can see more walk-ins. If they want more structured therapy for depression, substance abuse, PTSD, if they're willing to do that, then I can refer for that as well.
Then you refer to the specialty
Specialty
clinics that deal with them, or
Correct.
If it's right in their clinic and it's something that can be handled in a brief way, then you might refer them to me.
Correct.
And I will reach out to them and set up an appointment. And all this happens at Jesse Brown VA Medical Center, 10th floor, the Transition Care and Management Clinic. So I know you have some questions. You're watching us at home. Don't forget, give us a call, 312-738-1060. So also, what about, you use the word reluctant, which is a word that I use to describe many of the veterans that we see or come through the clinic. I call them reluctant help seekers, because sometimes we would see them, they come in during crisis and then disappear, and it's the follow-up, sometimes it gets lost. So one of the great innovations and award-winning programs in the VA, including Jesse Brown, is our Veteran Crisis Line. Our Veteran Crisis Line, a veteran or their loved one has a concern for their veteran, because reluctant help seekers, sometimes it takes a spouse or a loved one or a grandparent or a parent or a child to call. And this number can be called 7 days a week, 24 hours a day, and they call and talk to a live person. 1-800-273-8255, press 1. And at that point, they can have confidential help for the veterans and their families, and they would be redirected to our suicide prevention officer, who would then maybe come to you and then schedule an appointment.
Yep.
And then
That would be how it would work. Correct.
That's how it would
Yeah.
work. All right. So, what do you do to relax and unwind? I can imagine it can be really stressful at work. We want to get to know you, the nurse practitioner, and the human behind the white coat.
Well, I am very holistic as I bring that to the table with my patients. So I try to leave a lot of my issues or things, my cares at work, although we all take some of that home with us. But I try to do things that are outside the span of what I do every day at work. So I may go home and paint
Paint.
or walk.
Wow.
This is what I try to tell my patients to do
Yes.
as well, to try to go
Lead
home.
by
and-
example.
Yes, absolutely. Try to do some self-care, exercise, go out with your friends, blow some steam, that type of thing. So I try to be as well-rounded and be a, example for, everybody, for my patients as well.
Great.
So,
Great. So we have 5 minutes left in the program, and so viewers at home, this is your last chance to call in and ask Dr. Solarcheco or Renee any questions you might have, and find out about what's going on, or anything that we will try to answer. If we can't have the answer for you, we'll get your information and get that information to you. So, what is the best thing that you like about your job?
I like the veterans, I have to say
veterans.
that. I really enjoy working with veterans. I really am surprised how much I enjoy it. That's why it has kept me at the VA this long. I just get so much, I get fulfilled by working with them. I've learned so much. It's kind of a two-way street. I think I'm hoping they learn from me as much as I learn from them. Because it's a whole kind of microcosm that they have allowed me to enter to understand what's going on, especially the combat veterans. As I always tell each patient when they come in, they don't have to talk about their trauma experiences, if they don't feel comfortable talking about that during the first interview or even at the 10th interview with me. They don't have to. So I just I learn so much, and I'm just, I really do enjoy that.
Right.
So.
Right. All right. So I'm gonna put you on the spot a little bit, but what advice would you give to, say, a veteran that is watching, that was reluctant about establishing care at the VA, and maybe is a little bit too nervous to call in and ask the question that they might have?
Well, I've seen that over my many years at the VA. I started working at the VA 2 weeks before 9/11. So I primarily worked with Vietnam veterans prior to this, and I heard a lot of that. So so it was kind of difficult to kind of get them, to buy into to treatment. But I've seen it time and time again. Actually had several Vietnam veterans, find me and thank me for getting them into PTSD therapy.
Great.
So I think it's very worthwhile to give it a try.
That just reminded me that there are some upcoming documentaries that are coming up on the Vietnam War by Ken Burns, and I think that's going to be shown at the Chicago Cultural Center, and we have some other announcements too. There is our addiction treatment program. Again, addiction is one of those conditions that can impact the whole family system and then some. And if you are struggling with someone and that has addiction issues in their life, Jesse Brown VA ATP, the addiction treatment program, has a family night on Tuesday evenings, and we want to spread the word about that and let you know that that there is a team, there is help, and people are there to help. And you can give us a call at 312-569-VETS and VETS, and then ask to be transferred to the ATP program to find out more information about that group. Also, don't forget our Veterans Crisis Line is 1-800-273-8255 and press 1. And you can also check us out on Facebook.com, www.facebook.com/VA Chicago, Chicago VA Medical Center. So my name's Eric Prosher. This is Dr. Renee Stolarczyk, and we represent Jesse Brown VA Medical Care Transition Care Management Clinic. And I'd like to thank you for watching CAN TV 21. And you can learn more about Jesse Brown by contacting Jesse Brown VA or checking us out on our website or our Facebook page. And please stay tuned. We'll be back on August 24th, and we'll be your hosts again. And stay tuned for our next program, which is Fathers Who Care, and that will follow us in 5 minutes. Thank you, and goodbye for now.